Dental Assistant Practice Exam. Question 1. A permanent dentition consists of how many teeth? 28, 30, 32, 26. 32 teeth make up a permanent dentition. This includes 4 third molars or wisdom teeth. There are 20 baby teeth in primary dentition. Question 2. Which teeth are sometimes called eye teeth? Premolars, canines, incisors, bicuspids. Canine teeth are sometimes called eye teeth. They are also called cuspids. Canine teeth are designed for cutting and tearing food. Question 3. Which proximal surface of a tooth is closest toward the midline of the body? Occlusal, facial, incisal, mesial. Mesial is the closest proximal tooth surface toward the midline of the body. Occlusal, facial, and incisal are not proximal surfaces. Question 4. A permanent dentition consists of how many premolars? 4, 8, 12. 8 premolars exist in a permanent dentition. There are 2 premolars in each of the 4 quadrants of the mouth. Question 5. When a mouth is divided into fourths, the parts are referred to as quadrant, arch sextant, posterior/anterior. Quadrants are the 4 parts when a mouth is divided into 4 sections: upper right, upper left and lower left. There are 2 arches. They are maxillary, upper, and mandibular, lower. Posterior teeth are located in the back of the mouth while anterior teeth are located in the front of the mouth. Question 6. What is the vertical movement of a tooth into its functional position in the mouth called? Exfoliation, eruption, resorption, shedding. Exfoliation, resorption, and shedding are terms associated with the loss of primary teeth. Once the root of a primary tooth has resorbed, the tooth will become loose and fall out. This process is called exfoliation or shedding. The permanent tooth will then be able to erupt into the oral cavity. Question 7. The labial surface is the facial tooth surface closest to which area? Lips, cheek, tongue, palate. Labial and buccal are both facial surfaces. A labial surface is the facial surface closest to the lips. The buccal surface is the facial surface closest to the inner cheek. The labial surface does not contact the tongue or palate. Question 8. The temporomandibular joint causes movement in which dental arch? Mandibular, maxillary, quadrant, sextant. There are 2 dental arches. The maxillary or upper arch is immovable because it is attached to the skull. The TMJ allows the mandibular or lower arch to move up and down, forwards and backwards, and from side to side. Question 9. Using the universal system of tooth designation, what tooth is number 12? Maxillary right canine, maxillary left first premolar, maxillary left canine, maxillary right first premolar. Tooth number 12 is the maxillary left first premolar. Tooth number 12 is the first premolar or bicuspid to erupt in the maxillary left arch according to the universal system of tooth designation. Question 10. Using the International Standards Organization system of tooth recording, which tooth is number 25? Mandibular right central incisor, maxillary left second premolar, mandibular left central incisor, maxillary right second premolar. Maxillary left second premolar is number 25 when using the ISO system of tooth recording. Tooth number 25 is the second premolar or bicuspid to erupt in the maxillary left arch using the International Standards Organization system of tooth recording. This system is not frequently used in the United States. The most common tooth numbering system used in the United States is the Universal Numbering System. Question 11. Dental assistants are not permitted to use which dental tool? X-ray sensor, alginate, model trimmer, cavitrin. Dental assistants are permitted to take dental radiographs as well as impressions. They may also pour impressions and trim models. Only licensed dentists and licensed dental hygienists are permitted to scale teeth with a cavitron. Question 12. If you enter an operatory and see sodium hypochlorite, files, a rubber dam, and gutta percha sitting on a tray, which procedure will you most likely be assisting on? Amalgam, composite, root canal therapy, crown prep. Sodium hypochlorite and files are used to clean the canals of a tooth during root canal therapy. Gutta percha is used to fill the canals. Rubber dams may be used during many different dental procedures, but must be used during root canal therapy appointments. Question 13. Which type of restoration would not require the use of a matrix band or celluloid matrix strip? Class 1, Class 2, Class 3, Class 4. Class 2, Class 3, and Class 4 restorations all involve interproximal contact areas and require a matrix band or celluloid matrix strip to restore the missing wall. Class 1 restorations involve a single surface. Question 14. Why are intermediate restorations sometimes used in dentistry? Financial reasons. To determine the health of a tooth. While waiting for a permanent restoration. All of the above. Intermediate or temporary restorations may be placed when a patient needs time to save for a permanent restoration or is waiting for their insurance benefits to renew. Intermediate restorations may be used temporarily to determine if a tooth needs more extensive treatment. They may also be used while waiting for a permanent restoration to be fabricated in a dental lab. Question 15. Which tooth whitening option provides the fastest results? In-office whitening, trays with bleaching gel, brush-on whitening, whitening strips. In-office whitening may take as little as 1 hour. Teeth treated in this way may whiten up to 5 shades. Trays with bleaching gel, brush-on whitening, and whitening strips are all less expensive at-home treatments. These methods require several days of treatment to achieve the same results as in-office whitening. Question 16. The T-band matrix system is designed to be used on which teeth? Primary premolar, primary molar, permanent premolar, permanent molar. The universal matrix and retainer are used for restorations on permanent molars and premolars. This system does not work as well on primary molars due to their shape and small size. T-bands and spot-welded bands fit primary molars. There are no premolars in the primary dentition. Question 17. During periodontal probing, which sulcus measurement is considered normal? 3 mm, 4 mm, 5 mm, 6 mm. A healthy sulcus measurement is 3 mm or less. Deeper pockets indicate the loss of epithelial attachment, bone, and indicate the presence of periodontal disease. Question 18. Which of the following is not a mode of disease transmission? Bloodborne, airborne, indirect, sexually transmitted. Sexually transmitted is not a mode of disease transmission. It is a type of transmitted disease. Diseases may be transmitted through body fluids, the air, or indirectly from cross-contamination. Question 19. Which hepatitis virus should healthcare personnel be immunized against? Hep A, Hep B, Hep C, all of the above. Hep B immunization is an effective vaccine that healthcare workers should be given to prevent the risk of occupational exposure. OSHA requirements state that employers must offer the hepatitis B vaccination at no cost to their employees who are at risk of exposure. Hepatitis A is the least serious type of hepatitis. It is transmitted orally from objects that are contaminated with the fecal matter of an infected person. Vaccines for hepatitis C are currently under development. Question 20. Which of the following diseases can be spread through contaminated water supplies? Hepatitis C, tuberculosis, Legionnaire's disease, primary herpes. Legionnaire's disease can be spread through aerosols as well as aspirating contaminated water. It is not spread from person to person like hepatitis C, tuberculosis, and primary herpes. Question 21. A patient experiences an infection where symptoms appear quickly and are severe. What type of infection is this? Acute, chronic, latent, opportunistic. Acute infections are often very quick to appear and have severe symptoms. Unlike chronic and latent infections, acute infections normally have a short duration. Question 22. A patient presents with symptoms of an oral yeast infection. All of the following can cause this infection, except xerostomia, weakened immune system, diabetes, measles. Oral candidiasis is a yeast infection of the mouth, sometimes called thrush. It is caused by the Candida fungus. A weakened immune system, diabetes, xerostomia, or antibiotic use may cause this naturally occurring oral fungus to become overgrown, resulting in an infection. Question 23. What is a microorganism called that is capable of causing diseases? Bacteria, virus, syndrome, pathogen. Pathogens are organisms that are capable of causing disease conditions. Bacteria and viruses can be pathogenic but are not always. A syndrome is a group of conditions that occur together. Question 24. Which disease is an example of one caused by a spore? Tetanus, HIV, Hep B, none of the above. Tetanus, also called lockjaw, is a disease that is caused by spore bacteria. Hepatitis B and HIV are caused by viruses. Question 25. Sending contaminated impressions to a dental lab and wearing contaminated clothing outside of the dental office can cause which type of disease transmission? Patient to patient, patient to dental team, community to dental office to community. Impressions, models, and all lab cases must be disinfected before they are sent to dental labs to prevent disease transmission. Microorganisms may also be transmitted to the community through contaminated clothing and hair. Uniforms worn during patient treatment should not be worn outside of the dental office. Question 26. The assumption that all blood and body fluids are to be treated as if known to be infected is called OSHA compliance, CDC compliance, exposure control plan, universal/standard precautions. A patient may not know that they have an infectious disease or may not inform the dental team that they have a disease. For this reason, universal/standard precautions must be followed for all patients. The CDC issues evidence-based recommendations for health-related matters. OSHA is a regulatory agency that issues standards designed to protect the health of employees. The exposure control plan describes how the dental office complies with OSHA's bloodborne pathogens standard. Question 27. Dental assistants fall under which occupational exposure category? I, 2, 3, 4. There are 3 occupational exposure categories. Dental personnel who are regularly exposed to blood and saliva fall under category I. Those who are occasionally exposed are in category 2. Category 3 represents those who are never exposed to blood or saliva. Question 28. Where must needles, scalpel blades and orthodontic wires be disposed? Glass jar, contaminated waste, dumpster, sharps container. All disposable sharps and broken glass must be disposed of in puncture-resistant, leak-proof, closable, biohazard labeled sharps containers. They must be located as close as possible to the area of immediate disposal. Many dental offices have a sharps container in each operatory and in the central sterilization area. Question 29. Masks, eyewear with front and side protection, face shields and gloves are examples of what? PPE. Have. CDC, OSHA. OSHA's bloodborne pathogen standard requires employers to provide at no charge to employees personal protective equipment, PPE, which includes surgical masks, protective clothing, disposable gloves, utility gloves and protective eyewear. Question 30. Which type of gloves should be worn during an implant placement procedure? Examination gloves, over gloves, utility gloves, sterile surgical gloves. Sterile surgical gloves are worn during invasive procedures such as periodontal and oral surgery. Examination gloves are the most frequently worn gloves during routine patient treatment. Overgloves may be worn over contaminated exam gloves to prevent cross-contamination. Utility gloves are worn while processing contaminated instruments. Question 31. Scrap amalgam falls under which classification of waste? General waste, hazardous waste, contaminated waste, infectious waste. Hazardous waste poses a danger to humans or the environment. Mercury and other toxic chemicals fall under this category. State and local regulations must be followed when disposing of hazardous waste. Question 32. Paper towels falls under which classification of waste? General waste, hazardous waste, contaminated waste, infectious waste. Items that do not come in contact with blood or saliva like mixing pads, empty containers and paper towels are considered general waste and may be disposed of in covered plastic or metal containers. Question 33. The portal of entry for airborne pathogens does not include which area? Mouth, nose, skin, mucous membranes. Airborne pathogens cannot penetrate skin. Blood-borne pathogens may enter the body through a break in the skin, or through the mucous membranes of the nose and mouth. Question 34. Which type of infection presents symptoms that come and go? Chronic, acute, latent, opportunistic. Latent infections such as cold sores lay dormant until certain conditions such as an illness or stress cause an outbreak. Chronic infections are present for a long duration. Acute infections may be severe but are of short duration. Opportunistic infections occur in people with compromised resistance, such as patients with diabetes, autoimmune disease, or the elderly. Question 35. What type of film allows the entire dentition to be viewed on a single film? Occlusal, cephalometric, panoramic, all of the above. Panoramic films allow the entire dentition to be viewed on a single, large film. Occlusal and cephalometric radiographs only show a section of the dentition. Question 36. Which of the following is not a main component of a panoramic X-ray unit? Tube head, head positioner, panoramic film, exposure controls. Panoramic film is not a major component of a panoramic X-ray unit. The main components are the tube head, head positioner, and exposure controls. Question 37. What type of device does digital radiography use to record images taken of the patient's teeth? Standard X-ray film, with scanner, electronic sensor, MRI sensor, all of the above. Electronic sensors are used in lieu of standard X-ray films when recording images of a patient's teeth. While standard films can have their image scanned into an electronic program, they are not by definition digital X-rays. Question 38. Which of the following inflicts the most radiation on a patient? FMX, panoramic, bite wing series, PA. FMX series inflict more radiation on a patient because they require multiple exposures for 18 to 20 films. A PA is one film. A bite wing series consists of 2 to 4 films. A panoramic image is not intraoral. Question 39. What step helps prevent a large radiolucent area near the palate as seen on panoramic X-rays? Placing the patient's mid-sagittal plane perpendicular to the floor. Having the patient stand as straight as possible. Having the patient place their tongue on the roof of their mouth. Having the patient smile with their lips apart. Having the patient place their tongue on the roof of their mouth during a panoramic X-ray prevents the appearance of a large radiolucent area near the palate on the processed X-ray. Question 40. Why does digital radiography require less radiation than traditional X-rays? The X-ray beams are more powerful. It uses lower wavelength radiation. Sensors are more sensitive, all of the above. Sensors are more sensitive with digital radiography than traditional X-ray films, allowing the exposure time to be less, reducing radiation. Question 41. Refer to the radiograph to answer the next three quizitons. This is an example of what type of dental radiograph: bite wing, intraoral, periapical, panoramic. Bite wings and periapical images show a small section of the dentition. Panoramic images display the entire dentition. Panoramic radiographs are extraoral images, not intraoral. Question 42. How many root canal treated teeth are present on the mandibular arch? 1, 2, 3, 4. Tooth number 18 and tooth number 20 have been treated with root canal therapy. The material used to fill the canals after the nerves were removed can be seen on the radiograph as white lines going down the roots of the teeth. There are also several root canal treated teeth on the maxillary arch. Question 43. This patient has a bridge on the lower left quadrant. How many pontics does this bridge contain? 1, 3, 5, 7. A pontic is the artificial tooth that replaces a natural tooth that has been lost. Every bridge will have a minimum of one pontic. The pontic on this bridge is replacing tooth number 19. The bridge is supported by two abutments, number 18 and number 20, that support and retain the bridge. Question 44. Digital X-ray sensors cannot be sterilized, are sealed and waterproofed, must be covered with a barrier. All of the above. Intraoral sensors are waterproofed by the manufacturer, but because they cannot be sterilized, they must have a disposable barrier placed on them prior to use with each patient. Question 45. Which type of dental radiograph shows 3D images? CBCT, bite wing, occlusal film, panoramic. Bite wings, panoramic, periapical, and occlusal radiographs display 2D images. Cone beam computed tomography, CBCT, displays the head and neck in 3 dimensions. This is very helpful when planning implant placement, third molar extractions, and other surgeries. Question 46. What size Fillmore sensor is recommended for pediatric patients with primary dentition? 3, 2, 1, 0. Size 0 is the smallest film/sensor size and is recommended for small mouths. Children with mixed dentition may be able to tolerate size 1 or 2. Question 47. Which instrument was designed for taking radiographs of teeth with endodontic instruments inside of them? RIN, hemostat, endorrhea, bite block. Although several tools may be used as aids in capturing radiographic images, the endorrhea holder was specifically designed for endodontic procedures. Filling materials and instruments like files that protrude from the tooth do not have to be removed when using this tool. Question 48. Which type of radiation initially comes from the X-ray tube? Primary radiation, secondary radiation, solar radiation, scatter radiation. The initial radiation that comes from an X-ray tube is primary radiation. Once contact is made with skin, it becomes secondary radiation. Scatter radiation is a form of secondary radiation and is dangerous to the patient and the operator. Question 49. A lead apron with a thyroid collar will protect a patient from what type of radiation? Thermal, solar, primary, scatter. The thyroid gland is highly sensitive to scatter radiation. A lead apron with a thyroid collar must be used on all patients during radiographic procedures. Question 50. Why should fingers not be used to hold X-ray film or sensors while taking radiographs? The fingers are exposed to radiation. The fingers may get oils on the film. The image may be overlapped. The image may not be of diagnostic quality. Neither the patient or operator should hold an X-ray film or sensor while taking dental radiographs. This will unnecessarily expose their fingers and hand to dangerous radiation. Many tools are available to safely hold sensors and film.